You know, we hear about this a lot. Access to quality health care is an issue for some sectors of society, but understanding that and fixing it is something that we need to address. I spoke with oncologist Dr. Elizabeth Skinner with Novant Health about this issue and the possible solutions. Dr. Skinner, thank you for taking time out today. So let's talk about this. You were describing that there are inequalities in care, not only in the United States, but around the world. Can you describe that situation for us?
Yeah, inequalities in care can come from a lot of different reasons, and a lot of different factors play into that. Some things can be like socioeconomic, health literacy. How much do people understand the risks that are associated with different diseases? And simple things like access to care. How far away do they live from the clinic? How hard is it for them to get to the clinic? What type of insurance do they have? All these things can play into inequities, which can have devastating effects on outcomes.
So how do we fix this? I know it sounds like such a big, broad topic, and we have to do it in little chunks, I guess, but how do we fix this?
You're right. I think it's something that has to be broken down, and I think the first thing is doing exactly what's happening here, which is making people aware. I don't think that people recognize that even in local communities, there can be these healthcare inequities. And then you look on a more broader community, you look at the national level, you look at the world level, and I think we just have to first recognize this and then pick pieces of the puzzles that can be fixed and start working on those.
And are there little programs going on now that can kind of start chipping away at this issue?
With Novant Health, one of the things that we have been able to do is set up a mobile mammogram screening. This is allowing us to go into the community and reach patients and women where they live, as opposed to having them come to us. Another thing that we've been able to do at the Cancer Center is develop a free Pap smear screening clinic. And this is something that we have offered to women who are uninsured, who haven't been able to get Pap smears. And we've been able to reach out to these women and provide care and hopefully intervene before bad things start to happen.
This is great stuff. Good news. Thank you for your time today, Dr. Skinner. We appreciate it. Yeah, it's funny. One of the things she said, she was, what we're doing right now, she said, is step one, just to make people aware that it is as big of an issue as it was. It's one thing to say, we know there are gaps in the system in some sectors, whether you're talking about race or where you live or education level, she said that can do it, socioeconomic issues, but just knowing how bad it is makes people want to do something.
I thought the transportation part really stuck out to me, something that some people take for granted because not everybody has a car. Some people live in those rural areas where there is not a bus line to get to the doctor, to get to a good grocery store that has healthy foods. So it's nice to see that they're going out into the community and meeting the people where they are.
Especially when they're talking about, like, you need to go see a specialist, and then that you need to go this person, and then you need to go see that person. I mean, like you said, someone without transportation, someone with limited time and funds, you're not going to be able to do that unless they make some changes.
And as the oldest person in the room right now, I can tell you that it gets worse as you get older. You have to have access to that stuff. You're going more often than you ever did before.
And I think part of it too is just that it's complicated, right? Healthcare is complicated, right? And so a lot of times we just kind of throw up our hands and we're like, well, I'll just deal with it later, or I just won't do that, or whatever else. And that right there is an issue.
Yeah, and like you said, knowing the resources that are available to you that can help you out. Like there is money out there, there's grants out there that can help solve your problems.
And in our next half hour, I talked to Dr. Skinner again, but this time we're talking about advances in treatment for cancer. You'll be shocked when you hear some of the things that some types of cancer are close to being cured.
Which is fantastic to hear, because we haven't heard that. The only thing I want to say is be your own advocate, ask as many questions as possible. So if your doctor's office says, well, you need to do this, then you can say, well, is there a way for me to get there? Is there a way for me to do it online? Is there a way for me such and such? I mean, sometimes you just have to keep asking questions until they get the idea that you need that help.
That's right.
Right.